My first question, Mannie, is what did the workshops mean to you?
Well, they were firstly fascinating and interesting. It was the first time that I had ever worked with a group of osteopaths in the sense of studying a set of clinical problems. And I was very impressed with the openness and honesty with which they discussed their patients and also their own reactions to the patients, which together, of course, make up the dynamic. And I think we together learned a lot, bearing in mind that we spoke about a segment of the total population of patients who come to osteopaths. So what we came up with, what we discovered, it was not necessarily applicable in all cases, but certainly had relevance to the osteopaths for a significant number of their patients.
What would you say stood out for you? Was there a thread running through all the different cases that came up? Or was there a thread that ran through difficulties that osteopaths faced?
Well, there was a thread, and that was, one might call, the osteopath's identification with the patient. We might even say over-identification, which in some cases interfered with the osteopath's capacity to maintain a professional stance in their work.
We decided on 4 topics for the 4 workshops that we had. The names of the topics were pains as a means of communication, the heart sink patient, dependency, and the erotic transference. Could you explain a little bit about the choice of topics and why they were the most important to start off with?
Yes. Well, we selected topics that we thought were most likely to be experienced by osteopaths in their practices. So dependency would be one, in which the patient develops a fairly strong sense of dependency on the osteopath, which could get distorted somehow. The second was the heart sink patient, which is the patient whom one dreads for various reasons, mainly connected with the patient's type of presentation in the practice. The erotic transference we thought was also very important because of the potential for erotic feelings to develop between the patient and the osteopath. The fourth example was
pain as a means of communication.
Pain as a means of communication, which was a very important topic because in some cases patients' problems, psychological problems, problems of living, problems of relationships can sometimes be transformed into physical pain. And we thought at the time that it was very important for the osteopaths to understand the possibility that pain can be a transformed phenomenon from a psychological pain transformed into a physical pain. There was actually a 5th topic, which was endings. And we thought that too was necessary in order to be alert to the limits and the limitations of osteopathic treatment, and to hold in mind the idea that the relationship with the osteopath is likely to be of certain duration and will end. Which in some cases, and again I stress that it's some, not all, some patients may have difficulty in managing, and certainly some osteopaths may have difficulty in managing, and then enter into a kind of collusive relationship between the two, patient and osteopaths, to continue the relationship indefinitely.
Now, the purpose of this workshop was in order to give osteopaths an insight and tools into the relationship. Why might osteopaths need such tools?
Well, like any profession, the person, the individual practitioner, will focus very strongly on a particular aspect of a patient's experience. Now, in the osteopathic context, the focus will be on physical pain. And it may be, therefore, fairly easy to overlook other elements in the communication between the patient and the osteopath. And our thinking, our hypothesis was that pain may be experienced or developed and used as a kind of entry ticket into the osteopathic frame when something else may be bothering the patient. Something else quite deep, significant, but not recognized immediately, not talked about, and then the two might sort of proceed along a pathway, a clinical pathway, which at some level does address the pain, but at another may miss something important.